Okay, Pfrankmd fans, so we are here. It's actually one of my favorite filler treatments because it's not something people often think about. The neck lines. This happens to people of all ages. It is genetic. There are 18-year-olds that have it. I'm not treating 18-year-olds, but as you get older, it becomes more prominent regardless of whether you have a thin neck, a heavy neck, and it's something that really bothers people. They go horizontally. Botox doesn't work for it. Neuromodulators don't work for it. Laser resurfacing doesn't really work for it. Sometimes CO2 laser, which is very aggressive, can help it. But really, these lines could really only be treated with filler. It has to be done with the right filler. It has to be done the right way so it's not lumpy bumpy. I use a hyper dilute formula that we make ourselves here at Pfrankmd of hyaluronic acid, and we're really able to go into these grooves. Now the nice thing is that this is a treatment that lasts a long time. It is rare that I have to touch this up in less than a year. It's just is performed in an area that seems to last long, almost like under the eyes, but longer. We use what's called a micro-droplet technique. I use a very small 32 gauge needle, and she's had this done before, so she's really not that bad. She has a thin neck, but there's some areas about it, it's been at least a year where they've worn off. And what I'm really doing under just topical anesthesia is little micro droplets, and you could see it fill up literally right away. It's annoying. You can get a little bruising. I often V-beam this away. So at worst, you look like you have a tiny hickey for a day or so. And what I then do is I will take a Q-tip or my finger and we will massage it. The bumps will go away because again, it's hyper dilute. There is a good water content in this. And again, you're just sculpting it out with a very small needle. Again, most people tends to wear off on the side. She's being a very good patient. This and the earlobes are two of my favorite kind of non-typical filler areas. I'll do the earlobes another time. That's something where people's earlobes, we all deflate. Earrings sit differently, and just by putting a small amount of filler in the area, you got plump earlobes. I think you're good with that. The recovery is really very little, but it does take time. You do need to do this meticulously. Again, a Q-tip or just your finger massage aggressively. Go down here. You could really get a lot out of just one syringe of product too. So this is not something that really takes an enormous amount. Hyperdilute hyaluronic acid filler for horizontal necklines, AKA the tree rings. All right, quite easy if done right. See you later.